The presentation is about integrating tumor immune microenvironment parameters analyzed at tissue level with the CT imaging features, and specifically high throughput CT imaging features in terms of radiomic, because we strongly believe that only through an integration of both these aspects we can reach, or we can try to reach, a real precision oncology and a real personalized medicine. So this was the aim of our study to some extent. And we started from groups of 60 surgically resected non-small cell lung cancer patients that we deeply analyzed in terms of tissue immune parameters, so PD-L1 expression, tumor infiltrating lymphocytes, and whatever. And from each CT scan of these patients performed before surgery, we extracted specific radiomic features, specifically 841 radiomic features, so a huge amount of data, difficult to really interpret, but we are trying to do this. And to do so, we performed at first a non-supervised analysis in order to analyze, or to gross analyze, the distribution of these radiomic features among our patients. And we identified the specific clusters of patients exhibits a unique pattern of radiomic expression in this sense. And then we deeper analyze the corresponding tumor immune microenvironment of these 3 cases, because it's a small cluster of 3 cases, and we found some similarities in terms of CD3 positive tumor infiltrating lymphocytes and PD-L1 levels. And then we decided to compare this group with another group with similar tumor immune microenvironment characteristics, but opposite survival outcome, in order to understand whether there are specific radiomic features with an impact on the overall survival. So, in order to identify a signature, because this is our aim. We find a sort of signature that needs to be validated for sure, also in terms of a large group of patients, and because we found 187 CT-derived radiomic features which are differentially expressed by these 2 groups of patients. And then we selected the 20 top-up and top-down regulated according to signal-to-noise ratio, so a specific statistical test. And the last step of our study was to define whether these signature-related CTRFs had an impact on the overall population of our patients. And surprisingly, or maybe not so much, we found that yes, there are 2 specific radiomic signatures, which are large dependence emphasis and cluster tendency, which have an impact on the overall survival of our entire cohort of patients. So to some extent, I think it's a good result. I think that we can implement the risk stratification model, because if we will be able to add these CT-derived radiomic features, or maybe not all these CT-derived, but specific CT parameters and immune parameters to our risk stratification models based on PTNM or other recognized models, I think that we can reach a new level of real knowledge in terms of prognosis of non-small cell lung cancer patients. In addition to immune parameters, we are also studying genomic parameters of these specific cases, just to have an idea, because the impact of tumor mutational burden or specific gene expression signature and whatever. So our results are still preliminary, but we found something interesting also in terms of genomic expression profiles. So we will see.